The Master of Forensic Psychology program at UNSW is a very demanding program. It's 2 years full time, and it's not one you can really do a lot of work alongside.
To me, forensic psychology is any area of psychology that intersects with the law.
So there are probably three different types of work that forensic psychologists might engage in. The first is assessment, the second is treatment, and the third is relevant research.
We will get a referral with a specific question, and then the student will be allocated a supervisor, and together the student will work out a case conceptualisation, so gather all the information that they can that's available on that person before the person even comes in, and that's reviewed by the supervisor. And then they will also work out what is the most appropriate kind of test to use.
Experience at the clinic in particular got me ready for difficult times, and it really helped me in developing my own, I guess, characteristics of a psychologist that I want to see in myself.
I think students come into this field thinking that they are going to change the world. I say that because I think I did that as a student, and maybe partly I've contributed to that as a clinician, but the hard reality is that particularly the population of people we're working with are truly pointy-end. They are here with us because their problems are so great that they've come in contact with the criminal justice system. That's not your average Joe.
I thought I was like, yeah, I mean, they're offenders. It must be something that's tough. It must be a difficult clientele. But I didn't know. I didn't really know.
For the first time in that course, when I had that first client, there were moments where I was like, what am I doing? Why am I putting myself through this?
Most of the clients that we deal with are very complex clients, and we see clients who are actually, all of them are on some kind of order. So it is a forensic population that we're seeing, and most of them have significant issues. Almost all of them have drug and alcohol issues. Many of them have very complex mental health issues, as well as the offending behavior. And so we're trying to prioritize and deal with all of those issues.
I think when we talk to forensic psychologists, what they all seem to say is that their job's interesting and it's exciting, and that's because of the variety of different sorts of people they come into contact with.
The second function of the clinic is to provide treatment.
Sometimes if you come in with a very idealistic philosophy about I'm going to be able to save the world, and you see clients who don't want to see you, and it can be frustrating, it can be heartbreaking in some ways.
You want to help them, you want to make a difference in their life, but sometimes they're not ready to make that change, and getting them through the door is one of the biggest issues. There are several of my clients who I never got to see because they didn't show up, they weren't motivated to come. There have been times when I've seen them for a couple of sessions and you think it's going really well, and then you find out they're reincarcerated. So when you're working with these types of clients, the reoffending rates are really quite high, and it can be disappointing and frustrating when you hear that they've regressed or they haven't progressed. And I think that was one of the biggest challenges for working with some of these clients.
One of the things that I found quite challenging when it came to a client's perspective was the experience of suicide. When I initially had contact with it, it was something that I had a lot of trouble with. I didn't realise that it would impact me so strongly, and I didn't realise that the impact of hearing about a client's specific distress about these sort of issues was something that I actually felt really, although I was prepared for it, I didn't feel like I handled the situation appropriately, and I had a lot of reservations about what that experience was like for me, and that you reflect personally about what that means for you in the practice and what that means for the practice as a whole. And I was lucky that I had supervision to support me through that experience, but it also was jolting.
Fixing people? No, I would never use that phrase, no. God, no, I don't like the idea of fixing. I don't even like to think that I have any answers. I really like to think that all I do is facilitate change within a person. And by doing that, it's really just, the way I conceptualize that is that so often it's not until you talk about something that you really know what you want to do or what you need to do. And so often people haven't spoken about these issues in their lives.
Psychology is not about taking a pill and getting better. It's not about getting cured very often. And in forensic psychology, if you look, for example, at the literature on people recovering from drug and alcohol use, which many of our clients have, it takes multiple goes to engage with treatment and make a breakthrough in that area. It can take around 6 or 7 episodes of treatment to make significant gains. You have to be comfortable with being the second or the third or the fourth and seeing no tangible outcome for your work. Keeping up your motivation as a clinician is also difficult sometimes if you don't see results.
The professional practice component of the program requires you to do 1,000 hours of placements. Those placements can be in research environments or they can be in clinical or therapeutic environments.
Research is a vital component in forensic psychology, and indeed in any branch of psychology. Psychology and the work psychologists do must be evidence-based, so it's critical we engage in research. And that's particularly important for forensic psychology because it's a relatively small community. So it's important that all our practitioners are, at the very least, informed consumers of research, and at the very best, actively engaged in the research process themselves. And so we are completely unapologetic about the extent to which we push research training as part of our degree program.
Research placements might be in places like the National Drug and Alcohol Research Centre or the Bureau of Crime Statistics and Research.
Yeah, definitely one of the first things that I think is really difficult is just how time demanding it is, and like how big the workload is as well. Coming in, the first thing that you do on the course is the orientation meeting where you meet everyone, and just at that meeting they start pounding you about all the work that you're going to be doing, how much time you're going to be spending on the course, and how little social life you will have. And I remember sitting there going, well, that's what they always do. First day of the course, all of them just scare the crap out of you. But in reality, everything they said came true. And I think it was just really hard having to deal with coursework, and then once you start your placements, and then when the thesis comes on, it's just really difficult to manage your time. And I think just organizing everything and being able to really divide your time well and dealing with all that, that's just one of the main challenges.
So the research component of the program, the thesis in particular, is a quarter of the total marks for the entire program, and at least half the work in the second year, assuming you're a full-time student, at least half the work in the second year is taken up with that thesis. So that's a lot of evenings and weekends slaving away over large amounts of data, writing a thesis and so on, but it's an important part of the training.
Not every student who enrolls in our program makes it through the program. As I said, it's really challenging to finish this program, and people who don't really appreciate that fully, or who maybe try to maintain a life and try to keep part-time work going on the side, tend to really struggle to get through all of the coursework and the placement components. It's difficult.
You know, I often think that it actually has to be kind of in your blood to go and do this work. There has to be an absolute passion and interest in providing service to people who are often unmotivated and chaotic and really don't want to be in the room with you. It's, I think you have to be patient and committed and have often very, very specialized skills in order to go, not only to go and deal with the clients that we see, but to go and maintain self-care practice, and so that we can continue to do this work.
The kind of intern who is suitable for this course is somebody who is certainly open to the existence of other worlds than their own, who has the ability to reflect on their own experience, who is able to be humble, who is able to have a very realistic appraisal of their own competence, and not to barge into people's lives, into which we're allowed to go by our privilege, but to go in with a degree of respect for the lives which have brought people to the paths at which we see them.
If you're interested in enrolling in a forensic master's program or just learning more about forensic psychology, there are lots of resources you can access on the internet. You can go to the UNSW School of Psychology website and look at the coursework, the postgraduate coursework programs. You can also go to the APS College of Forensic Psychologists And we have a website for our clinic, which is the Wentworth Forensic Clinic, and you can go and have a look at the program information there.